worldwide Endomarch 8 years ago. We have made significant progress, thanks to all of you. But we have a long way to go. For example, due to your efforts and worldwide Endomarch, we have been able to now find or have at least an app to diagnose endometriosis, or at least guide to some degree diagnose patients with endometriosis who have pain and also, or they want to get pregnant. Patients who have tried to get pregnant, all of their tests are normal, their husband tests are normal, they don't get pregnant. A high percentage of these patients, they have endometriosis without any symptoms at all. The app developed by the Worldwide Endomarch and Nezhat Family Foundation is now available free of charge to all the patients and interested parties around the world, that they can download it, use it, and guide them and help them to seek appropriate help. Or if they have significant amount of pain and they think they might have endometriosis, this app could guide them in the right direction. And significant other efforts being made in other directions by all the universities around the world. And these are because of your interest and your encouragement, and we thank you for that. You can easily find many of these advancements or the past webinars about endometriosis of the different organs like bowel, bladder, ureter, diaphragm in the webinar session of the Worldwide Endomarch. You can find a session about diet, what to eat, alternative treatment on the webinar session. And you can also find any other interested topics that you want on the Worldwide Endomarch web. The session today is dedicated to early detection of endometriosis. Recently, Dr. Ceana Nezhat published a book very popular about this subject, and he is going to direct the session for today. Dr. Tosin Odunsi happened to be my brother, and he has significantly contributed to the advancement and understanding and more care about endometriosis. He has devoted his life to patients and teaching the patients, and also teaching other physicians internationally, again, in respect to endometriosis. I welcome him, and I would thank you again for your attention. Dr. Ceana Nezhat.
Hello, everybody from around the world. Thank you for joining us today, and thank you, Cameron. I'd like to thank all the patients who have been the advocate about themselves and getting this session more successful. The idea of endometriosis awareness has been going on for years, but unfortunately, in spite of all the organization approaching the societies, it did not get enough attention until the patients themselves became involved and became self-advocates. So on that line, 10 years ago, we had a World Symposium on Endometriosis in Atlanta, about 60 experts from around the world, and about 600 participants, including the patients. And Dr. Cameron Nezhat gave a keynote speech about endometriosis and ancient disease. And reality was that for thousands of years, unfortunately, the problem of the women have been overlooked, and basically they were taught that, okay, you are a woman, you're born with this condition, live with it. They have called it hysteria, etc. So on that meeting, it dawned on us that the patient advocacy probably would be the best approach. So Dr. Ceana Nezhat with the idea came and we supported and we created the Endo March. And that's where we are today. Going forward, personally, and also my brothers, we realized that a lot of these patients who come to us with advanced stages of endometriosis, they've had this problem, the symptoms for years. They've been diagnosed with irritable bowel syndrome. They've been diagnosed with interstitial cystitis. At times, they were diagnosed with psychological disorders. So we decided to put the focus on early detection and increasing awareness about recognition of the symptoms on the early stages. So on that line, we published our experience on adolescent endometriosis, but it was for the medical journals. We went further, and for the first time, we published a book specifically on adolescent endometriosis. It's my pleasure that I have one of the co-editors of the book, Dr. Jennifer Dietrich, with us today, that she would speak. But before we go further, I'd like to invite one of our patients, Miss Emma Henry, to come and tell you her story of how she started at earlier than age of 14 with her symptoms. So Emma, are you with us?
Yes.
Hello, Emma. Emma is Emma Henry. Thank you for joining us. Tell us where you are and your story.
Well, so yes, I'm Emma. I really appreciate this opportunity to speak today. I live in Greenbrier, Arkansas. So the story starts about 8 or 9 years ago, a long time ago. When I was in 4th grade, I was about 9 or 10. I started having acne before everyone else in my grade. Lots of premature development going on, and you know, the kids on the playground would be like, what are those dots all over your face? And I, you know, there were a lot of mental repercussions with things like that. And so, you know, I got a little older. I got into 5th grade. I moved schools. I moved 3 hours away, different part of Arkansas. And I had terrible acne. My body hair growth was overwhelming, much more than any of the girls that I was friends with were experiencing. Lots of early breast development. And when I was in 5th grade, I was a gymnast, and we started to notice some masculine features begin to occur. My leg hair was dark and coarse, like a man's beard. And I was able to accumulate muscle mass very fast as a gymnast. I had zero flexibility, which caused a lot of injuries for me. But we noticed all these things were off. I never felt great. And my acne, it just got worse. And then in 6th grade, when I was 11, I started my period. And immediately it was extremely heavy flow, lots of pain that radiated all around my torso into my spine. And there was so much pain, the acne just kept getting worse. I eventually got to a point, I have some pictures, and this is not a very good quality picture, but this is when I was 12, and very bad acne, very painful acne. So my dermatologist thought that it would be a good idea to start birth control pills for the acne and to hopefully bring some regularity to my cycle. But she wanted me to see an OBGYN for that because I was so young. So I went to the gynecologist, and he started me on a birth control pill. The first one I took, I had a terrible side effect. I had migraines, and I was put on amitriptyline for the migraines, which just sort of messed me up. It was not a very pleasant experience. I wasn't acting like myself. I couldn't focus in my classes because they were daily headaches. It was like clockwork, and I never found relief from that. So he was like, okay, let's try another one. The next one, I had hair loss. There was a spot about the size of a quarter on the top of my head that the hair just fell out. It just left. And so I was put on Rogaine for that. And he said, basically, there's 30 something different birth control pills. We're just going to keep trying them until we find one that works. But I was so miserable from those experiences that we decided to stop. But with that, my cramping got worse. My acne got worse. My back pain started to get very bad. And so a pediatrician put me on meloxicam for pain. And over time, that started to give me very bad heartburn, chest pain, acid reflux. And so then we discovered that I had stomach ulcers from that. So I was put on Nexium. So all these medications are just sort of accumulating through this time. When I finally get to 7th, 8th grade, I'm 13, 14 years old. I had to quit gymnastics because I tore my ulnar collateral ligament in my elbow because I was so tight. Everywhere was so stiff, and it was a terrible injury. It was a year's worth of physical therapy. I started to gain weight pretty rapidly. The cramping was unbearable. I couldn't just sit in class and deal with that. It was too much. But I never said anything to, people other than my mom, because I thought that's what every girl was going through. I thought it was just a normal, difficult time, and it was just something that I would get through and it would eventually be okay. But I started to realize that no one seemed to be bothered by it quite as much as I did. And I thought maybe I was being a baby about it. And I was terrified of admitting that. Gymnastics coaches sort of train you to never complain about pain. So it was difficult. Eventually the back pain and the cramping, it sort of migrated into the rectum, and I had terrible constipation, and everything, it was so painful just sitting down. I could feel it was so much pain. And so eventually my mom, who was a nurse practitioner for, I think, 25 years, she confided in one of her doctor friends and told her all of my symptoms. And she recommended for us to see Dr. Ceana Nezhat. And so out of the blue, we were like, okay, let's travel to Atlanta. I'm so fortunate that my dad is a pilot, so making the trip is not that difficult for us. But we go, and I get ultrasounds, and we look at everything, and Dr. Nezhat says that there's a high probability that I have endometriosis. We schedule a surgery and a laparoscopic surgery, and just like a month after that first consultation, we had the surgery. And I remember waking up. My parents were very nervous because I think it took about 4 hours. It took a long time. And I remember waking up, and I remember my mom telling me, like, you had endometriosis. It was stage 3 out of 4. It was really bad. We've done the right thing. And I just started bawling. It was overwhelming because I was nervous. I was like, you can't see it. It's not such an obvious thing. There's all these signs and symptoms that point towards it, but I was still very nervous about everything. And it was an immense weight off my shoulders. And so after the surgery, which I was able to heal very fast from, thank goodness, because it was a very easy process. I had a little bit of trouble, regulating cycles. I was put on Mirena, and for a while I did not have a cycle, but they began to come back. And so we added NuvaRing, and now I have very little cramping, very little flow, very manageable, normal cycles to deal with. There was a point where I had a benign mass in my breast because I had fibrocystic breasts. So I had to get that removed. But one of the main things, other than the surgery, that I think has brought me relief is I had to make a big lifestyle change. I had to change the way I ate. I drastically changed my diet. And you can tell in these pictures, this is when I was 13. And these pictures are exactly a year apart. You see my brace from my injury, the terrible acne. I was overweight. I was muscular. I was almost anemic. Lots of bodily pain. Everything hurt. Everything was exhausting. And this was exactly a year later, about a month or two after surgery. And it just seems like there was so much more life in me after that. I could not be more blessed than I have been to have the resources that I've had, because I don't know what I would have done. I think the original gynecologist I went to would have had to, give me a hysterectomy very early in life. I would not be able to have all the babies that I want to have one day. I love babies, and I'm so glad, because there was a time in my life where I thought that was not going to happen. And now I'm here, and I'm in college, and I'm doing all these things with my life that I could not deal with. I could not push through with such discomfort and such pain. And so it has been so amazing to be able.
Wonderful. Emma, thank you so much. One thing I have to tell you, your skin looks beautiful. So we're very proud of you. A few things, remember, for your history. Emma was 14 years old when she came to me, but before she comes, she has been in the emergency room. She has had MRI, CAT scan. They have checked in all the area. And from one medicine, at one point, they even have given her narcotics at the age of 14. So that brings us now that two factors from Emma's history is, one, that she also had polycystic ovaries. Polycystic ovary is a high estrogen level who could stimulate endometriosis. There is a misunderstanding that polycystic ovary patients could have high testosterone, and testosterone could suppress the endometriosis. That is not true. And I like to patients to be aware of combination of symptoms and the condition that Emma had, that you could have a combination of hormonal imbalance in addition to endometriosis. So am I correct, Emma? Wonderful. So on that line, I'd like to invite Professor Jennifer Dietrich from Baylor to, I know we don't have a lot of time to elaborate, but mention how many, because she's an adolescent and pediatric gynecologist. Tell us why symptoms of people like Emma is so overlooked in the medical community.
Yes, thank you so much, Dr. Nezhat, for having me. And, thank you everyone for joining us from, all over the world. This is really amazing that we get to share knowledge today. But yes, as a pediatric and adolescent gynecologist, this is certainly something that is on our radar screen quite early for young girls. We take care of girls from birth all the way up to 21 usually, but certainly, we're seeing young girls earlier because we do see that many young girls are presenting with puberty earlier, just as Emma shared with her story. And Emma, thank you for sharing all of that. It was very brave of you to do that. I think that because we're seeing girls early, we're having the conversation about periods and really what they're like. They're a little bit more comfortable describing the symptoms that they have earlier in life, which is really great. And because perhaps their mothers have gone through something similar and they don't want their child to go through what they went through. We are certainly going to have a heightened suspicion when there's a family history of endometriosis or polycystic ovaries or other gynecologic conditions, to look for a similar condition, because that tends to run in families. And when girls are having significantly heavy and painful periods from the time that they start their first period, it heightens our suspicion for several things. One of which is to look for any anatomic difference, where we're looking at the development of the uterus and the vagina. So through that, we can confirm if the anatomy looks normal. And then we cannot really see on ultrasound, as Emma mentioned, any evidence of endometriosis most of the time. It is frequently microscopic. And in these young girls that we frequently see at Texas Children's Hospital, it is one of those things that will ultimately require a laparoscopic diagnosis. Now, we have to balance a lot of different factors. We have a teenage population who's busy with school and sports and things like that. And so, having a surgery is sometimes disruptive to their routine. But if they opt to do a trial of medical management for 3 or 4 months, we may try that. But if they fail that, we kind of really encourage moving on to make a diagnosis from there, because we can ultimately access better treatments and we can pair surgical management with medical management. This is ultimately going to be the best for their long-term fertility and their long-term health, both physical and psychological. And then I think the other thing to just mention is that we really do try to approach it from a multidisciplinary standpoint. So while we want to balance all of the factors with regard to addressing pelvic pain in young women, part of the hard thing about addressing pelvic pain is that there's so many different pelvic organs in the same spot. That's why many times these young women are going through multiple different tests to try to figure out where the pain source is. And ultimately, one of the things we still have to manage is sometimes the musculoskeletal pain. And so we do try to set up some of our girls who have endometriosis, especially when it's advanced, with a physical therapist, because sometimes they need to rebuild their core muscles. And in addition to medical management and prior to that, surgical management, kind of helping to manage some of the musculoskeletal symptoms that they developed over time can be really beneficial to the long-term care. And so I'm just glad that there are more of us these days. Our specialty has been a burgeoning specialty really since the 1980s. And there are many more of us available and accessible all throughout the country to young women. And so I do hope that they come in and see us.
But how long it takes for these young girls to be referred to you by the pediatricians or by the doctors? Not everybody is even aware of your subspecialty these days.
Yeah, I mean, that's exactly right. So, it can sometimes take years for people to get to us. This is partly because, maybe they're looking at other sources of potential pain that might be down in the same pelvic region. And, if they don't respond to courses of treatment, either from a GI specialist or from a urology specialist, or perhaps even, maybe they've seen an orthopedic surgeon or a neurosurgeon because of neuropathic pain, sometimes it's years before they come and see us. And I would say that we see the girls sooner when there's a family history, because the parents put 2 and 2 together and say, I had this, and I think I'm going to take my daughter earlier for evaluation.
That is an excellent point. In our practice, when I say our practice, mostly my brothers and myself, majority of our patients are referred by other patients. It's a lot of time the symptoms are overlooked by their physician. Emma's history, is perfect. Had her mother not called and looked around and called another doctor, who by accident, it happens that she was a patient of mine. And when she came to my office, she was a pediatrician, the worst case of endometriosis. So I started working with that pediatrician, telling her, pay attention to your patient's symptom. And that was Emma's mother used to work with her. It came through patient and the mother, exactly that's what you said. So that brings us to the next part I like to say. Unfortunately, the awareness amongst medical community, even today, is not that much about on early detection of endometriosis. On that line, I'd like to invite my fellows to come and tell you when was the first time they even get exposed to endometriosis. I usually travel, do volunteer work around the world and teach and advocate awareness about endometriosis. And I usually have one fellow, but because of the COVID, I haven't been traveling. So this year I have 4 fellows. So I would like to invite my fellow, Dr. Tosin Odunsi, to tell her story, then Dr. Du, then Dr. Hincapie, and Dr. McGrail. Go ahead, Tosin, Dr. Odunsi.
Thank you so much, Dr. Nezhat. And it's been such a pleasure being here and hearing the story of Emma and having Dr. Dietrich give her perspective as well. And I'm so grateful for this opportunity to study under Dr. Nezhat and take care of the patients that we do. In terms of when I heard about adolescent endometriosis, I did my medical school training at Meharry Medical College in Nashville, Tennessee. I also got my MPH in Philadelphia, did my residency in Connecticut. And it actually wasn't until I came here to Nezhat Medical Center that I learned about adolescent endometriosis. And I was very surprised because we're taught that this is an adult disease. So I was very shocked to learn about it. And I'm so grateful that Dr. Nezhat has been able to write a book about it and make parents aware of it, make the younger patients aware of it. And also, as I'm leaving fellowship, I'm able to educate my colleagues about how to recognize it and just bring about awareness as I go on with my future steps as well. So thank you so much for doing this.
Thank you, Dr. Odunsi. So you have your master's in public health.
Yes, sir.
Was there any mention during your training about endometriosis?
No, not at all.
Okay, so thank you very much. I'd like to ask Dr. Du to come, and she's Dr. Du also, her story would be interesting. Go ahead. Thank you, Dr.
Hi, everyone. Thank you very much for giving me this opportunity and join this meeting and have a chance to talk about a little bit how do I know about the adolescent endometriosis. So I graduated from medical school in China and came this country for postdoc training. And I did several years research about the pathophysiology of endometriosis at Yale. And during that time, I worked with plenty of scholars from, different countries, but we pretty much talking about adult endometriosis. Never really the adolescent endometriosis, this topic never really brought up till like, I think it was 3 or 4 years when I was doing research. There was a resident, she came to talk to me, said she wanted to apply for the pediatric and adolescent gynecology fellowship, and she mentioned about this disease. But it's still a concept of disease. During my resident training, I never really had a chance to encounter one of the cases. And till now, I came to study with Dr. Nezhat and read his books and about teenagers' story. I was shocked. I said, wow, this is a real disease. Usually we all know for adult endometriosis, it's gonna take like 1 to 5 years to get a diagnosis, but for teenagers, it's even take longer. And I'm so glad Dr. Nezhat, published this book. And I think it's very, very helpful for patients and also actually very helpful for the OBGYN physician to recognize this disease. Thank you.
Thank you very much. Emma, could you please come back? And I'd like to, the book that Dr. Du is referring and Dr. Dietrich was also referring, it's geared towards the physicians and also the patients. Emma, are you with us?
Yes.
Okay, thank you. So Emma really truly has become an advocate for endometriosis. In that book, Emma and her mother wrote the story, which I have had so many comments and compliments, the same way that Dr. Dietrich told her, thank you for sharing your story. It takes a lot of courage to be open-minded, come and tell your story, especially in this society that people turn things against you. The bullying, you said the kids were, and now you are in college. Of course, you look beautiful, you are smart, you are in college. Is it what, 4.5 years later from your diagnosis? On that book, we have addressed nutrition, polycystic ovary, but briefly, Emma, tell your story and your mom's story, that what you wish you had done, somebody had done for you on the very early stages. Wouldn't you wish you had gone to somebody like Dr. Dietrich or myself or people who are aware? Tell us.
Yes, the first thing I wish I would have known is that it's not normal, and it's okay to look for help. And of course, it seemed like there was no one around us that understood what it was or even suggested it. My dermatologist, I went to pediatricians, I went to the gynecologist, and it never came up. The one pediatrician that put me on Nexium and helped me discover that I had stomach ulcers said, you know, this might be related to a female issue. That's the most that he was able to suggest, but it would have saved a lot of pain and you know, for girls that experience this, just time, a lot of time. The quicker you act, the more likely you are going to be able to preserve fertility. And so having that resource sooner definitely would have been preferred.
Thank you very much, Emma. So this brings us to my next guest speaker, Ms. Nicole Shealy. So I want to let you know there are physicians that they are cognizant of early detection of endometriosis. Nicole, are you with us?
I'm here. Hello.
Good. So Nicole is a perfect example of being very lucky, because her mother suspected, she said her symptoms are not normal. She took her to a doctor, Dr. Wayne Hudak, who was an endocrinologist before. He was an endometriosis surgeon, and he was cognizant that these symptoms are not right. So she didn't end up going to the emergency room, CAT scan, MRI. Her doctor properly diagnosed her at the age of 17. And I'd like you to share your story with us.
Thank you. And I just want to echo everyone. I'm super grateful for this opportunity and all of the work that y'all have done in spreading awareness of this condition. And I'm actually 5 days post-op. Dr. Nezhat operated on me on Monday for my second procedure. So I'm feeling a lot better already. And just very, very grateful for this community and this opportunity. But Emma, much like you, I was in and out of the emergency room. I was in and out of GI doctors, MRIs, endoscopy, colonoscopy, all before I was 17. I missed a lot of high school. I missed a lot of school. A lot of people didn't understand what was going on. I even transferred high schools because the public high school that I was going to was not exactly understanding of me missing so much school and my health and figuring out what was going on. I was also diagnosed with IBS, stomach ulcers, all of the above. I was given a script for Lortab in the ER when I was 17, which is terrifying looking back on it now. It all kind of started when I got my period around 12, just really bad cramps, really heavy periods, I got on birth control when I was 16 and I would bleed for a month. They'd try another one. I'd bleed for another month. You know, it led to back pain, insomnia. I was depressed. I was told it was all in my head. I would be, you know, mid barf in the ER at 3 a.m. and the doctor would be like, "You're doing this to yourself." And one ER doctor even almost accused my mom of doing it to me. So it was very traumatic. It was very tough. And I'm 29 now. And even, you know, in this last go round of endometriosis before my surgery, which my endometriosis did come back. But like Dr. Nezhat said, Dr. Hudak was able to really manage my pain for as long as possible, my growth, my fertility. Dr. Nezhat can speak to how great I look inside there because I'm not sure, but everything was manageable. But this last go round, I was having some really bad pain in my left hip. And it started about 2 years ago. It would come with my cycle and then it would go away. And then it started to come more frequently and I couldn't get it to go away, you know, muscle relaxers, Advil, Tylenol, and even going up to some mild painkillers. Nothing was really helping. It finally got so bad that I could not walk one weekend and I was terrified. I was having panic attacks. I went to my general doctor on Monday and she looked at me and I said, "I have endometriosis. Could this be related?" And she said, "No, there's no way. I don't think so." And I was that little 17-year-old girl in the ER again, feeling like I was crazy and I was doing this to myself and it was my fault and this was all in my head. And even as a 29-year-old woman, I was scared and I felt silly and crazy. And 2 days later, I was in Dr. Nezhat's office and he told me, "Nicole, it's basic anatomy. Of course it's your endometriosis." He was like, "Your uterus is pulling on everything." So it just to be validated in that way was so powerful for me. I just burst into tears because it's such a long journey that even now that I'm 12 years in it, they still, you know, it can happen where they don't believe you. But luckily, as Dr. Nezhat said, when I was younger, my mom went into Dr. Hudak's office. It was her, luckily, thank God, it was her gynecologist. And she was sobbing and she said, "Can I please tell you about my daughter? I don't know what's going on. She's been sick for over a year. She's been diagnosed as having a parasite at one point." They were just throwing things at me. They really didn't know. And Dr. Hudak said, "I know exactly what she has. Bring her in." And within a month, I was in the operating room and I was feeling so much better. I went to college in Dallas, Texas. Now I live in Atlanta. I work in Atlanta for Compass Real Estate, and I'm excited to get back to work. Maybe not Monday, but soon next week. Really feeling like I've turned a corner after my surgery on Monday, and I'm just so grateful.
Thank you very much, Nicole. There are a few points you brought out I'd like to elaborate. One is going to the right doctor. Two, the right doctor sending you to the right surgeon. The reason is, unfortunately, endometriosis treatment requires expertise, especially in the teenagers, younger people. The goal is to do no harm. We would not want to harm anything. And when they tell you endometriosis, I excised it for you and you are cured, that is not true. Endometriosis does recur. I mean, with all due humbleness, the method that we have developed, and I say actually it is Dr. Cameron Nezhat's original development, and we have elaborated on it. The method of excision that we use, it is not just cutting. We do excision with precision. We do it with microsurgical principle. That way we do not damage the surrounding tissues, not just going and cutting. Sometimes when Emma says her surgery took like 3 hours because she had endometriosis on her bladder, bowel, we don't go and just cut it. we go like micro knitting, cell by cell vaporizing. It is better to take a longer time and do the treatment with precision so it would not cause damage. So she was a perfect example of had early detection by a proper endometriosis aware physician. She was properly placed to the right place. She had proper treatment with all due humbleness. I'm not bragging about what we did, but that is true. And the second look that we did. Now, when her symptoms came back, in spite of suppressive therapy, I was aware we did a second look, and truly the endometriosis is coming back. Nothing as bad as it was before. And it gave us the idea that she had no damage to the tubes, ovaries, or the uterus. So what Dr. Dietrich says, managing after the surgery is also important. Putting on medication, being awareness, sometimes physical therapy. So Nicole, thank you again for sharing, and now gives hope to people like Emma that 12 years later, back and normal and everything is good. So on that line, I'd like to invite our other fellows, which are fellows of Society of Reproductive Surgeons. Their focus is fertility and fertility sparing. Dr. Maria Hincapie, go ahead. Tell us your story.
Good afternoon. Thank you so much, Dr. Nezhat. My name is Maria Hincapie. I am originally from Colombia. I did my med school training in Bogota and my residency training in Cali, Colombia. And it wasn't until the first year of residency that I really learned about endometriosis, but I did not receive any specific training on adolescent endometriosis. And this was during the 4 years of residency. It was only until I joined Dr. Ceana Nezhat for fellowship that I truly learned about this important topic. And I really want to thank the Drs. Nezhat and everybody involved in Endo March for providing this space for both patients and providers, and for highlighting the importance of this topic. So thank you so much.
Thank you. So we are having from the Colombia, Latin America, you heard about China. Now, I have a recent graduate, Dr. Kaitlin McGrail, that she tells you about when she learned about endometriosis, her focus, and she is also fellow of Society of Reproductive Surgeons, who is going to do infertility. Kaitlin?
Thank you, Dr. Nezhat. Yes, so I did my 4 years of medical school at the University of Arkansas, and I did my 4 years of OBGYN residency at Louisiana State University. And I don't remember ever hearing about endometriosis when I was in medical school. And then when I got to my residency, it wasn't until I was in my 3rd year of residency where I really got any kind of formal education or knowledge of the patients with endometriosis. But it was definitely only adults that I saw at that time. So I didn't hear or even think about really adolescent endometriosis until coming here to this fellowship with Dr. Nezhat probably a month ago. So I'm very grateful to be here to learn more and to be able to spread that information. And I'm very happy that Endomarch and Dr. Nezhat are bringing awareness of this disease across the world to both women and providers who need more information about it.
Thank you very much, Kathleen. So Dr. Dietrich, you heard the patients, you heard the fellows, you are in a highly respected academic environment. What would be your message to the patients and to our fellows, and what do you wish for the medical students and the teaching in the future?
Yeah, I mean, definitely, I think that for the patients and families, our pediatric and adolescent gynecology field has really expanded. And part of the reason that we have done this is that we are truly advocates for children and adolescents. This is our specialty, and we don't just see problems that typically affect adults that are kind of presenting in earlier age groups. it really is different how we're managing these conditions and diagnosing these conditions early in life. We have to balance all of the factors of kind of making a diagnosis in order to help a child move forward through their academic career, but also balance fertility in the future. So we want to make sure we can make a diagnosis early, get them on the track of healing, even though we know that this is a condition likely to recur, but get them to a place where perhaps if we can treat early and suppress early, the recurrence is less and the effects on the pelvic organs are much, much less than they would have been if it had not been diagnosed. This is something that we are specialized in, and therefore we look for it early. There are warning signs. And so, you know, certainly what I tell all of my patients, even if they're just coming for a routine visit as kind of a well child check sometime between 13 and 15, you know, we talk about periods and what's normal and what's abnormal. If you are getting to the point where you're missing school several times a month, that's not normal. If you cannot do your regular activities, including gymnastics, that's not normal. There's something that is resulting in severe pain that really shouldn't just be managed with narcotics. There's so many other medications that are better these days so that people don't get addicted early either. And so we need to investigate. I think, you know, that's what I'd tell families is come seek us out so that we can have a conversation about puberty and periods and talk about what truly is perhaps normal or abnormal. We also are experts in managing conditions related to uterine anomalies and vaginal anomalies. Many of these conditions, particularly if they're obstructive, are going to be a setup for endometriosis as well. They go hand in hand. And so that could be something as simple as a duplicated uterus or even a septate uterus. We automatically think that endometriosis is going to be higher risk because it is, and the studies have proven that in these patient populations. And so we know to look for it. I would hope for medical students, and luckily at our institution, we have medical students rotate with us every month as part of an elective, and they get to see this. They get to engage in our team, seeing young girls sometimes as young as 11. You know, while I mentioned 13 to 15, we see girls from birth all the way to 21. And because girls are presenting earlier with periods and puberty, sometimes we may have a child as early as 10 years of age having severe periods, and we just might make a diagnosis then, believe it or not. So we are going to look for it. Our medical students are seeing this, and hopefully it inspires them to go on to engage in women's health, maybe perhaps even become a specialized surgeon such as Dr. Nezhat, his fellows and his team, and or a pediatric gynecologist, such as many of my colleagues as well, where we can kind of help start that journey of diagnosis and treatment, and then help graduate you safely and not in pain anymore to the adult side and to a specialist such as Dr. Nezhat.
Thank you very much, Dr. Dietrich. Yes, we have one of your trainees, luckily, in Atlanta at Emory, and it's been a pleasure working with her. So thank you for teaching the students and increasing awareness. So on that line, we have Dr. Debra Lee and Shruti Agrawal. These are Dr. Ceana Nezhat's fellow. I'd like them to share their story with you if you are available online. Dr. Agrawal or Dr. Lee? Okay. By the time they come back, I'd like to go back.
I'm right here, sir.
Oh, go ahead. Sorry. Go ahead.
That's okay. Good morning. My name is Dr. Agrawal. I'm one of Dr. Nezhat's fellows. I'm his second year fellow. I've been with him a whole year. So I can definitely tell everyone that even though I've learned so much about endometriosis with him over this past year, I realize how much more there is to learn, because being with him even now, he tells me every day that as long as you stay with me, you're going to learn something every single day, something that you've never learned before, which is absolutely true. I think in residency, we just do not have the opportunity to go into depth with endometriosis and realize how much there is to this disease. So I feel very lucky to be able to train with Dr. Nezhat and be able to try to solve the mystery of this enigmatic disease, as he likes to call it.
Yes. When did you first learn in your training? When did you first learn about endometriosis? Medical school or residency or?
Right, sir. I mean, with endometriosis, we do learn about it in medical school, but it is just in passing. It is one of the several things you would learn in the block of time you learn for obstetrics and gynecology. So it's definitely not given the importance or time that it deserves, because in med school, we learn so much that we kind of glance over endometriosis. And then even in residency, we just don't get to see as much of it in the hospital. And we're not very good with diagnosing it as general OBGYNs. I just don't think we learn as much as we should be learning about endometriosis.
And when did you learn about adolescent endometriosis?
Basically never, till I got to Dr. Nezhat, actually, to be able to see how young patients are presenting with the same symptoms as our older patients. I mean, as a general OBGYN, when we see younger patients with these symptoms and signs, we just think about starting them on birth control. We never think that it could be endometriosis or that they may consider needing surgery. So definitely adolescent endometriosis is not something that we learn a lot of at all.
Thank you. Dr. Lee, are you with us?
Hello, I am.
Yeah. Go ahead, please. Tell us your story.
Yes, absolutely. So I am from Texas. I did medical school in San Antonio and I did residency in Austin. I then actually was out in practice for 3 years as a generalist OBGYN. I do consider myself lucky that I had some exposure to learning about endometriosis in residency. We had a minimally invasive gynecologic surgeon who really worked hard to make sure we were exposed to endometriosis. But one thing that this fellowship has really made crystal clear for me is that endometriosis is a complicated disease. It affects many organs. There are many symptoms that are not typical, that are atypical symptoms, like many of the patients have spoken about, the GI and GU symptoms, you know, the thoracic symptoms. And then for adolescent endometriosis, it really wasn't until I got here, you know, and I think that it is really something that is, you know, important. I think it's going to be a very important message for us as fellows to kind of carry forward in our careers and to bring to light. And I'm thankful to have the exposure to hearing from patients, to being able to identify symptoms, and to also have the pediatric and adolescent gynecology lens as well. So I'm very thankful for this opportunity. So thank you.
Thank you very much, Dr. Lee. So we have a few more minutes, and I'd like to give the podium back to Emma and Nicole. In a minute or two, tell us about what you wish for us as healthcare providers to do for your children in the future. You are young, you will have daughters. What do you wish for them? Emma and Nicole, either one?
I can go ahead. I definitely wish that this was a condition that was asked about early on in a young woman's healthcare. We put it together pretty early on in my diagnosis that my grandmother and aunt both suffered from this. My grandmother had 5 or 6 miscarriages. My aunt ended up having a hysterectomy in her 50s, and she was just like covered in endometriosis. So I definitely, I hope that this is something that is, you know, it just becomes as normal as any other condition. You have a family history of diabetes or breast cancer or anything like that, because it's so misunderstood. And there's such a stigma around, you know, women's health, and we're complicated beings with complicated organs. And I'm just really grateful for all the research that you're doing so that Emma and I can have a better life.
Thank you, Nicole. Emma, are you with us?
Yes. Well, similar to Nicole, there is a little bit of family history. My aunt had to have a hysterectomy in her 50s, and then my mom had a partial hysterectomy with Dr. Nezhat, and she was covered in endometriosis too. I think that the work that's being done here is incredible, and while it hasn't been an easy process, I consider myself pretty lucky to be a part of this because I'm blessed in the way that the events unfolded, but otherwise I would have not known anything about this. And now, having been through it, and hopefully all the other patients that have been through it, we can help be a part of this movement. We are real people who have really experienced this, and I think that is going to be part of what it takes to spread the awareness, being on the front lines of it, being a firsthand experience of it. And I just wish that there was it was more in the forefront of pediatricians in terms of young girls describing their pain. I wish it would come up more. I wish it was considered more, but I think that we will get there.
Thank you very much, Emma. Thank you, Nicole. And I really want to thank the Endo March organizers and the volunteers to keeping this message forward. I really appreciate all the faculty participants today and the speakers. So on that line, I would like to pass it on to Dr. Ceana Nezhat. Thank you again, and it's a pleasure to be with you.
Thank you very much, Dr. Ceana Nezhat. I would like to thank you for that excellent program. And especially, and of course, I'd like to thank all of your guests one by one, Dr. Dietrich and all of your fellows, and especially Emma and Nicole for their brave history and for their very interesting background. And unfortunately, we see it every single day. It is very touching to listen to them and see how when their condition, the endometriosis, was diagnosed, that was a big weight lifted up of their shoulders. And it's unfortunate that we have to see this in this day of an age with so much knowledge that young patients go and they're diagnosed for years and years. And we thank them for their participation and thank you for putting this excellent program together. We thank all of you for viewers around the world. Please continue your support to help the patient with endometriosis in your communities, in your countries, in your medical schools. Support your physicians, your surgeons, your researchers, your government officials to help and forward and make progress that finally we put an end to that entity. Please watch the former programs about endometriosis, and the webinars are all informative to you. Also, as I mentioned, there is an app. It is called Nezhat Endometriosis Advisor. It is completely free all around the world, can guide you for further diagnosis of endometriosis if you have pain or if you are trying to have children and you have not been successful to get pregnant. All of your tests are normal. Your husband tests or your partner tests are normal, and you are not getting pregnant. There is a high possibility you have endometriosis. Seek proper help and you could be helped. The next month program is going to be about chocolate cyst, endometriosis cyst, ovarian cyst, that sometimes patients like Emma that said that even had been suggested to have hysterectomy. Unfortunately, even now, we see young patients who have had hysterectomies, ovaries removed or destroyed because of endometriosis, and they are younger, they want to have children. There is a program, the guest speaker and the guest program director would be Dr. Ceana Nezhat for the next month, for the month of September. And once again, we thank all of you for your participation and wish you a wonderful month until we see you for the program in September. Wishing you a great day and night wherever you are in around the world.
Bye-bye.